One patient I want to present you, it's Klaus, and everything is easy with Klaus. He received a Tendyne valve, so a relatively new valve where you see it's located over here. And this patient deteriorated after this scan, and we are going to answer why. So first of all, what is the Tendyne valve? This is another patient where you see the valve over here. These are the remnants of the mitral valve, the anterior, the posterior leaflet, and there's this huge umbrella-like structure and the actual valve inside here, and here the fixation at the cap, or with a cap at the apex, or more the apical regions. Here you see it in a transverse plane, the residual opening and closing of the mitral valve, which is of course not relevant anymore because there's this huge umbrella below. How does it look like in 3D? This is a TTE study. From top we see here the opening and this umbrella-like structure, and here we are looking from below towards the valve, and we see with this special light, the flexi light, this umbrella-like structure, and here the opening of the mitral valve. In a TE study you can even see it more clearly. Here's the valve. The valve is opening in this large umbrella. So here we have the umbrella-like structure, and this is the structure we will find at the apical region. So this is at the area of the atria, and here it goes to the ventricular side. So minimal invasive valvular implanted structure. Now the suspicion was, is there a paravalvular leak? And take a close look over here. The LVOT seems rather narrow. Here you also have several turbulent flows, and looking at the subcostal imaging, you see that there's truly a turbulent flow, not towards the atrium, so it's not likely that there is a paravalvular leak, but that is actually LVOT obstruction. So the valve itself looks nice, but the LVOT is significantly narrowed. So LVOT obstruction leading to decompensation, and in his case, small amounts of crystalloids led to decompensation. With small dosages of diuretics, there was severe worsening of hemodynamics. A usage of catecholamines was catastrophic for this patient, and eventually, unfortunately, this patient did pass away.